The ideal treatment and the best treatment, like all your kidney, liver and heart failures, is a transplant. Hematopoietic stem cell transplant or a bone marrow transplant is the ideal gold standard for aplastic anemia. But because of the availability and the complications, it's usually reserved for less than 40 or 50 years. Patient is fit. The ideal recommendation is to go for bone marrow transplantation. Ideally, we check for a matched sibling or a person who has a full match, or even in children, we tend to look for other matches. So, if a transplant cannot be done because of many issues like non-availability of a donor, or patient is elderly or has different other issues like comorbidities, diabetes, hypertension, heart failure, kidney failure, the next option would be something called immunosuppression therapy. So, because like we said, 70 to 80% of our aplastic anemias are secondary to autoimmune disorders, that is self-destruction of own stem cells by own immunity. So we do something called immunosuppression. Bone marrow transplantation, the cure rates are almost 80 to 90%, one-time procedure, and the counts will recover within 2 weeks. But aplastic anemia also has grading. There is something called severe, very severe, which we commonly see, and a non-severe, that is seen in 10 to 15% patients where the bone blood count is not very low, they don't require any transfusion. So there we can avoid transplant and ATG, they can still be kept on follow-up with oral drugs like cyclosporine or tacrolimus plus a drug called L-thrombopag. Summarizing, the aplastic anemia is a bone marrow failure syndrome. It is very common these days and seen in all the spectrum of age. Diagnosis of bone marrow, once we confirm based on age, the best treatment would be a bone marrow transplant. That's not the option. Then we have immunosuppression therapy with ATG, cyclosporine or tacrolimus plus an L-thrombopag. That should give us the results. Thank you.